Welcome to our channel Nursing Tips Official. Safdarjung Hospital Nursing Officer Exam Part 3. Question number 101. A 39-year-old mother with obsessive compulsive disorder has become immobilized by her elaborate hand washing and walking rituals. Nurse recognize that the basis of obsessive compulsive disorder is often C. Feelings of guilt and inadequacy. Question number 102. A patient with borderline personality disorder who is to be discharged soon threatens to do something to herself if discharged. Which of the following action by the nurse would be most important? D. Ignore the client's statement because it is a sign of manipulation. Question number 103. A patient with antisocial personality disorder belches loudly. Staff member asks, "Do you know why?" People find repulsive. This statement most likely would elect which of the following client reaction? B. Embarrassment. Question number 104. Which of the following approaches would be most appropriate to use with a client suffering from narcissistic personality disorder when discrepancies exist between what the client state and what actually exists? C. Limit setting. Question number 105. Which of the following foods would the nurse eliminate from the diet of a client in alcohol withdrawal? D. Regular coffee. Question number 106. A woman is 37 weeks pregnant and she is bleeding profusely with no pain. Is suggestive of A. Antepartum hemorrhage. Question number 107. Puerperal woman is more susceptible to venous thrombus due to C. Stasis of blood in veins due to late ambulation. Question number 108. The breastfeeding mother of infant with lactose intolerance asks the nurse about dietary measures. The nurse tells the mothers to avoid A. Hard cheese. Question number 109. The cause of change in size and appearance of breast during pregnancy. A. The breast changes are due to secretion of estrogen and progesterone. Question number 110. A pregnant woman has a positive history of genital herpes but has no lesions during the present pregnancy. The nurse should plan to provide which of the following information to the client? You will be evaluated at the time of delivery for herpetic genital tract lesion and if lesion is present, a cesarean delivery will be needed. Question number 111. A rubella vaccine is prescribed to be administered to a 2 days postpartum client. The nurse preparing to administer the vaccine develops a list of the potential risks associated with this vaccine. The nurse reviews the list with the client and the questions that the client to avoid. C. Pregnancy for 2 to 3 months after the vaccination. Question number 112. A perinatal client with a history of heart disease has been instructed on care at home. Which statement, if made by the client, would indicate that the client understands her needs? B. I should avoid stressful situations. Question number 113. A contraction stress test is called for the pregnant client and the client asks the nurse about the test. The nurse tells the client that a small amount of oxytocin are administered during internal fetal monitor to stimulate uterine contraction. Question number 114. A client is scheduled for pap smear. The nurse provides instruction to the client regarding preparation for the test. C. The test is painless. Question number 115. The nurse is teaching a pregnant client about the morning sickness in pregnancy. Which of the following sign and symptom would indicate a need for further education? A. Visual disturbances. Question number 116. A nurse need to check the most important parameter if patient is on magnesium sulfate therapy. C. Respiration is more than 12 per minute. Question number 117. When performing a postpartum assessment on a client, a nurse notes the presence of clots in the loggia. The nurse examines the clots and notes that they are larger than 1 centimeter. Which of the following nursing action is most appropriate? B. Notify the physician. Question number 118. A nurse in the labor room is performing a vaginal assessment on a pregnant patient in labor. The nurse notes the presence of umbilical cord protruding from the vagina. Which of the following would be the initial nursing action? A. Place the client in Trendelberg's position. 119. During the ovulation phase of the menstruation cycle, ovulation is caused by the secretion of C. Luteinizing hormone. Question number 120. The large amount of progesterone secreted during the secretory phase of menstrual cycle is a response for D. Sustaining the thick endometrium of the uterus. Question number 121. The hormone responsible for the menstrual cycle are D. Gonadotropin, estrogen and progesterone. Question number 122. Before a client with syphilis can be treated, the nurse must determine the C. Existence of allergies. Question number 123. The final step of the research process for researcher is to A. Utilize the findings. Question number 124. Which of the following is not the element of an informed consent? B. Offer answer only for selected questions. Question number 125. Which of the following is not true about the characteristics of good research? A. Conducted using large amount of funds. 126. Translating the message into verbal and normal symbols to communicate the receiver means A. Encoding. Question number 1 to 7. The manager gives incentive for an employee on their extra effort on new project. The power which used in this situation is B. Reward. Question number 1 to 8. The state of complete disorganization and confusion which leads to the loss of identity and direction. It is known as C. Chaos and disruption. Question number 1 to 9. The assessment method that occurs after the patient has been discharged is C. Retrospective evaluation. Question number 130. All of the following is types of conflict except B. Manifest. Question number 131. One who knows the ins and outs of the trade. D. The full details. Question number 132. Device for catching is known as C. Trap. Question number 133. Who was the first to use the word statics? A. Gottfried Achinwell. Question number 134. Which of the following rate is applied to calculate the total number of deaths occurring in a hospital after 48 hours of admission for a period? Total number of discharge including death minus death under 48 hours for the same period in a hospital multiplied by 100 AGDR. Question number 135. In which century the vital statics was originated? C. 19th century. Question number 136. Identify the odd term out. D. World Wide Web. Question number 137. Different network can be linked using D. Modem. Question number 138. Hypertext is a text that B. contain links to other document. Question number 139. The domain name in a URL refers to the A protocol. Question number 140. Software designed for specific purpose is called as D. Application software. Question number 141. Pycnosis is characterized by B. Nuclear shrinkage. Question number 142. Mallory's degeneration seen in alcoholic liver disease is a form of A. Hyaline degeneration. Question number 143. Severe generalized edema is called as C. N. Sarka. Question number 144. The activation of caspases is likely to lead to A. Apoptotic cell death. Question number 145. A reduction in the total leukocyte count is called B. Leukopenia. Question number 146. Reduced number of platelet is found in all the conditions except D. Von Willebrand disease. Question number 147. Normal adult hemoglobin contains B. 2 alpha chains and 2 beta chains. Thank you.